like to think of genetic counselors almost like navigators. They're people that help families, individuals understand their risk of getting certain inherited genetic conditions and help them navigate the process of getting genetic testing, from deciding whether or not they want to get genetic testing in the first place, which is a big decision for a lot of people, to ordering the most appropriate genetic test given that person's unique family history, their own medical history as well, and then interpreting those results once they do come back if people do elect to get genetic testing. Someone would see a genetic counselor for several different reasons. One could be that they have a family history of a certain type of condition. Cancer is a really good example. So let's say a patient has an extensive family history of breast cancer or ovarian cancer. They may be at risk for a certain inherited genetic predisposition syndrome that would make them at increased risk for developing cancer themselves. I always think it's really important for people to have genetic counseling in the context of genetic testing. Genetic testing is very different than other medical tests that people might get. The results can be nuanced and they can be complicated, and the tests themselves are it can be very difficult to order the proper test. Direct-to-consumer testing has both really positive aspects for things like making genetic testing more accessible to the general population. And so there's a lot of ways that people can get access to their genetic health information using direct-to-consumer testing. There are situations, however, where working with a genetic counselor can be really helpful in terms of understanding why, a direct-to-consumer test may not be the most informative test for a person's family history. One of the biggest buzzwords in healthcare right now is precision medicine and personalized medicine. And often that involves the integration of genetic testing into a clinical setting. And if we are working with providers like genetic counselors who are specialty trained in understanding that testing and understanding how to appropriately integrate that into healthcare, that can only advance things like precision medicine to make them more mainstream in clinic and much more tailored to those individual patients.